Hello, I'm Jennifer Telford, a gastroenterologist at St. Paul's Hospital in Vancouver, Canada, and a co-investigator in a study published this month in GIE entitled A Multicenter Randomized Trial Comparing Uncovered and Partially Covered Self-Expandable Metal Stents and the Palliation of Distal Malignant Biliary Obstruction. The study was conducted at 4 sites: the Brigham and Women's Hospital, Massachusetts General Hospital, Boston Medical Center, and the Mayo Clinic, Rochester. We randomized 129 patients with distal malignant biliary obstruction to receive either an uncovered or partially covered metal stent. All the stents were inserted endoscopically and the patients were followed up on a monthly basis. Our primary endpoint was recurrent biliary obstruction, and secondary endpoints were patient survival, serious adverse events, and the mechanism of biliary obstruction. We anticipated that impenetrable coverings for the metal stents would solve the problem of tumor ingrowth, but felt that these new stents should be evaluated prospectively and compared to traditional uncovered stents in a randomized fashion. In the absence of published evidence, endoscopists may choose a stent based on their perception of different stent efficacy under certain circumstances. An example of this would be choosing a different stent based on the underlying etiology of the biliary stricture. Randomization should distribute different patient and endoscopist characteristics equally into both of the groups. We found that both stents performed very well. Of the 129 patients enrolled, only 31 developed recurrent biliary obstruction. There was no difference in recurrent biliary obstruction or in patient survival between the 2 stent groups. However, we did find that a significant number of the partially covered stents migrated distally, which resulted in biliary obstruction, in duodenal hemorrhage, and in 2 cases, duodenal perforation. None of the uncovered stents migrated. Migration of covered and partially covered metal stents has been reported for all endoscopic stenting indications. While undesirable in treating malignant strictures, the same features that result in stent migration may be useful for planned stent removal in patients who require temporary stent placement. Despite the covering, we also noted tumor ingrowth as a cause of recurrent biliary obstruction in patients receiving a partially covered stent. Our study is the first randomized comparison of commercially available, partially covered, and uncovered metal stents, although other studies are underway. The results add to current knowledge by showing that there is no difference in recurrent biliary obstruction between the 2 stents, and by showing a statistically significant and clinically important tendency for the partially covered stent to migrate. Future stent development should focus on covering materials that prevent tumor ingrowth but do not lead to migration. I don't believe that these characteristics are necessarily mutually exclusive. Our trial demonstrated that the tendency to migrate was not associated with significant prevention of tumor ingrowth, while a previously published randomized trial by Isayama and colleagues showed an absence of tumor ingrowth with their covered stent and no reports of stent migration. To summarize, our multicenter randomized trial found no difference in recurrent biliary obstruction or patient survival between the uncovered and partially covered metal stent. There was a significant increase in serious adverse events in the group receiving a partially covered metal stent due to an increased rate of stent migration.